If you're in your 30s, you're probably starting to notice the early signs of skin aging. So here are 10 things you can do to make your skin look its best. Hey, if you're new to the channel, welcome. I'm Dr. Sam Ellis. I'm a board-certified medical and cosmetic dermatologist in Northern California, and I'm here to help you understand your skin and find products that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. The reason I think it's important to really start thinking about your skin, of course in your 20s, but especially in your 30s, is because you start to really notice those signs of skin aging. And I find a lot of my patients at this point in their life are wondering what they should be doing. I think before we decide what we need to be doing for our skin in our 30s, it's important to understand the skin aging process. Oftentimes when someone is nearing their 30s or gets into their 30s, they start to notice specific skin changes that begin to bother them. So something like dullness, for example. Our skin cell turnover really slows down as we get older, and so we're not sloughing off those top layers of skin as readily, and so the skin begins to look a little bit drab. People in their 30s will also notice that their skin tends to look a little bit drier, and that's just because you're getting further away from those oily teenage years. Those sebaceous glands that make oil for your skin are not working as much. Your skin also naturally produces hyaluronic acid, which keeps it supple and moist, but that production also decreases as we get older. Another thing people may start to notice in their 30s is volume loss. So you get some descent and shrinkage of the fat pads in the face, so you may notice hollowness in the cheeks and in the temples, and you also get a little bit of bone loss. And you can think of bones as the real support structure under your skin, and as bone loss progresses as we get older, you essentially lose that support structure under your skin, and it's one of the main contributors to sagging. As we get a little bit older too, our hormones tend to shift, and that can really lead to some undesirable changes in the skin like adult female acne. I'm in my mid-30s and I think about my friends, and we're having babies and our weight is fluctuating, and we're also starting to see the sun damage that we incurred when we were kids and in our 20s really starting to take its toll now. And obviously when I'm talking about skincare in your 30s, it's a little bit of a generalization. We're all on a different aging timeline. We all have different goals. So some of you may be watching this in your 20s because you're starting to notice those early signs of aging. Some people are blessed and never experience these things or experience them much later in life. Tip number one is get on a skincare routine. And this might sound silly to say. I think a lot of people who watch YouTube videos and especially are interested in skincare started a skincare routine a long time ago. But what I find is a lot of my patients are coming in their 30s and they have never really established any type of skincare routine. And when I'm talking about a skincare routine, it doesn't have to be anything extensive. It just has to be something that you consistently do every single day. I think as we get into our 30s, we have a lot more going on in our life. We have obligations to our friends and our families and our careers, and it can be hard to find time to do skincare. But if you make it a habit, it's gonna help you be consistent, and in the end, it's gonna help you meet your skin goals. And a consistent skincare routine does not have to be a 10-step routine. It can involve a cleanser and sunscreen in the morning, a cleanser and a moisturizer in the evening, maybe a retinoid, we'll get to that. But I think as long as you have something in the morning that's going to prepare and protect your skin for the day, and something at night that's going to nourish your skin and maybe help with those early signs of skin aging that you might not be loving, all your bases are really covered. Speaking of a skincare routine, that brings me to tip number two, which is use SPF every single day. And that's not just the sunscreen that's already included in your makeup. That's a nice first step, but ultimately the sunscreen in makeup is generally not protective enough because you're not applying enough makeup to actually get the SPF that's stated on the bottle. So I really like people to apply a separate sunscreen. And then of course you can go in with makeup that has sunscreen in it, but you shouldn't rely on that alone. Another thing I'll notice is with my patients coming in, whether it's for a medical derm visit or a cosmetic consultation, is they'll be really mad at themselves for not wearing sunscreen when they were younger. And they feel like, oh gosh, I'm not starting till my 30s. Is it too late? And it is never too late to start wearing sunscreen. You can see benefits incorporating sunscreen into your routine at any stage in your life. Sunscreen is important for so many reasons. Number one, it protects you against skin cancer, and skin cancer affects 1 in 5 Americans. So it's a really real risk that is highly, highly preventable. The other thing is sunscreen protects you against premature signs of skin aging, whether that's fine lines or wrinkles or irregular pigmentation. There's even a good clinical study that shows that wearing sunscreen consistently can actually help reverse signs of skin aging. So it's not just about prevention, but it's also about reversal. I think part of incorporating sunscreen into a regular daily habit is finding a sunscreen that you absolutely love. And I feel like sunscreen technology has come a long way in terms of textures and tints, and there's a sunscreen out there for everyone. I have lots of videos with my favorite sunscreens, so it may take some trial and error to find a sunscreen that you absolutely love, but once you have that, you're set. Tip number 3, start a topical retinoid. So retinoids are a very famous category of ingredients in dermatology because they are sort of the holy grail anti-aging topical. They help with things like fine lines and wrinkles because they stimulate collagen production and they inhibit collagen breakdown. They also help correct pigmentation and make the skin look less dull. So when I think of like one skincare ingredient besides sunscreen that's going to make a meaningful, tangible difference in your skin, it's a retinoid. Retinoids come in prescription form, so maybe you've heard of something like Retin-A, which is also known as tretinoin, but you can also get non-prescription retinoids like retinol and retinaldehyde from other retailers. The other thing that's really important to note about topical retinoids, and it's sort of something I counsel all of my patients on when they're starting to think about incorporating a retinoid into their routine, is they can cause a little bit of irritation, stinging, redness, flaking when you first start them. So starting with something that's a little bit more gentle can help ease that transition. I have an entire YouTube video dedicated to beginner retinoids, but one of my favorites is the Rock Retinol. Rock is sort of one of the OG brands when it comes to developing a stable retinol that can be incorporated into a variety of products, but they make an excellent face cream that I think is great for beginners. The other thing that I really like about this is that it's formulated in a really rich moisturizing base, so you're sort of achieving 2 skincare steps in one. It can act as your topical retinol and your moisturizer. Another topical retinoid that I really love is by Medik8, and it's their Crystal Retinal. Some people want to know what the difference is between retinol and retinal or retinaldehyde. And the real difference is when retinol is absorbed into your skin, it has to go through 2 conversion steps to reach the active form in your skin called retinoic acid, whereas retinaldehyde only has to go through 1 conversion step. And for that reason, it's more powerful, but also seems to be a lot more gentle for some people. The reason I like the Medik8 Crystal Retinal is because, one, Medik8 is sort of a pioneer when it comes to formulating really stable, effective retinoids that can be accessible to many different people. But I also love that this system incorporates various strengths. So it has 5 different strengths of retinol. So you can start with something a lot more gentle. And as you see the progress and as your skin begins to tolerate those stronger retinoids, you can work your way up in the system. I think one thing that's important to note about topical retinoid use is that you should stop it if you're trying to conceive or you are pregnant. Now, you can definitely use topical retinoids when you're breastfeeding, but if you're in that period of your life where you're trying to get pregnant or you're actively pregnant, I wouldn't recommend using a topical retinoid just out of an abundance of caution. One thing my patients will ask me if they're sort of in their childbearing years is, well, is it even worth it for me to start a retinoid now, or should I just wait till I'm done having kids? And I think if your skin is not particularly sensitive and you're able to ramp up to regular retinoid use over the course of a month or 2, it is worth it to intermittently use a retinoid. When we're thinking about the benefits that retinoids have, it's cumulative over the course of your life. So if you can use a retinoid intermittently in your 30s and then get more consistent about it in your 40s, it's still going to benefit you. Skincare tip number 4 is consider incorporating some type of exfoliation into your skincare routine. Like I mentioned earlier, as we get into our 30s, our rate of skin cell turnover kind of slows down and we may notice that our skin looks a little bit more dull. And although retinoids can help somewhat with this, some people need an added boost from a pure exfoliant. When we think about exfoliants, they tend to fall in 2 main categories: physical exfoliants and chemical exfoliants. Physical exfoliants physically break apart that outer dead skin cell layer. So you can think of like scrubs, for example. And then you have chemical exfoliants. So these are gentle acids that work to break apart your skin cells through a chemical reaction. I feel like dermatologists in general have a preference for chemical exfoliants because they can be a little bit more gentle on the skin and you can really tailor them in terms of strength to getting the outcome that you want, whereas a physical exfoliant feels a little bit more harsh and intense. But in reality, I think either one can be really effective. And some people really prefer physical exfoliation. And if that doesn't cause excessive irritation for you, go for it. Some of my favorite exfoliating acids are glycolic acid. So this is a very small molecule acid. It can penetrate a little bit deeper into the skin and can exert the most powerful exfoliating effects. If you have more sensitive skin, you may want to consider something like lactic acid or mandelic acid because it's a little less harsh on the skin. Now, when it comes to glycolic acid exfoliants, I've talked about this one so many times, but the Good Genes exfoliant by Sunday Riley is amazing. And actually, now that I come to think of it, they have a glycolic version and a lactic acid version. I usually recommend starting with the lactic acid, again, because it's a little more gentle, but if you feel like your skin can handle a little extra oomph, you could switch over to the glycolic acid. The other thing I really like about chemical exfoliants, whether it's glycolic acid or lactic acid, mandelic acid, salicylic acid, is they're generally considered safe in pregnancy, in breastfeeding, and when trying to conceive. And a lot of my patients will bring up the fact that like, hey, I'm pregnant and I feel like my skin looks horrible and I want to do something that's either anti-aging or gives me a little bit of that glow that everyone told told me I was gonna have in pregnancy and I'm not really experiencing, and topical chemical exfoliants can be a great way to help you achieve that. The last thing I'll say about exfoliation in general is that it's up to you how frequently you think your skin can handle it in your skincare routine. So if you're using a topical retinoid every single night, I think a chemical exfoliant 1 to 2 nights max a week is really appropriate. However, if you're not using a topical retinoid, some of these chemical exfoliants are gentle enough to use every single night or every other night, and you won't experience irritation. Tip number 5, use a moisturizer. Now, I have considered myself a dry skin gal my entire life, but I could kind of get away with the moisturizer that was incorporated into my sunscreen as part of my morning routine. As time has gone on though, I really find that I enjoy using a moisturizer both in my morning routine before my sunscreen, as well as in my evening routine to sort of lock everything that I've applied in place. As you get older, your sebum production or your oil production tends to go down, and so those natural oils that your skin may have relied upon in the past are no longer available for you. Moisturizers can also be really beneficial in your 30s because they help with sort of this immediate plumping and smoothing effect. So if you're starting to notice those fine lines on your cheeks or around your eyes, they can help blur and correct that. And then lastly, in your 30s, you may be starting to incorporate things like a retinoid or chemical exfoliant, and your skin barrier may be taking a temporary hit. So using a nourishing and soothing moisturizer regularly is going to help you tolerate these other actives better. One of my favorite rich, creamy moisturizers is by Skin Fix. It's their triple lipid peptide moisturizer. One of the reasons I really like this is because it is rich and nourishing and creamy, but it's not so heavy that you couldn't wear it during the day under your makeup or under your sunscreen. I found at least that as I've gotten into my 30s, I crave those richer, creamier moisturizers. And although I do love a lightweight moisturizer from time to time, my skin really drinks this one up. If you are looking for something a little bit more lightweight or a moisturizer that's still going to hydrate your skin, but maybe you're wearing it in hotter weather or over the summer, I really love the Aveeno Oat Gel Moisturizer. I really love this one for dry or irritated skin, and it's really nice that it's available at the drugstore. Now, I know I just talked a lot about chemical exfoliants and retinoids, 2 things that have the potential to irritate your skin. So tip number 6 is don't overdo it. I feel like sometimes once we've decided that we're going to incorporate a skincare active into our routine, we really just go all in. We don't ease ourselves in. We might start a retinoid and a chemical exfoliant at the same time. Don't do that. When it comes to anti-aging, it's a marathon, not a sprint. Also, I find it's a lot harder to make a skincare habit and use things regularly if your skin always feels like it's irritated or inflamed. So give yourself a little grace when you start incorporating these things into your routine. It took me almost 6 months to be able to use a retinoid every single night. So if it takes you a little while, that is no big deal. Don't push it. So I know we've been talking a lot about facial skin, but tip number 7 is don't forget your neck. Your neck is one of those things that you might not be thinking about, and then all of a sudden you look at your neck one day and there's lines or wrinkles or crepey skin, and now it feels like it might be too late. Most women will start to see noticeable signs of skin aging in their neck in their 40s and 50s, so if you can get ahead of it in your 30s, you're going to be so happy. Now, a lot of neck aging is really genetic. You might look at one of your parents and go, ooh, I might be headed there. But there are still proactive things you can do. The first thing is all of the skincare that I've already talked about using. Sunscreen, retinoids, chemical exfoliants, they can all be used on the neck as well. Now, neck skin tends to be a lot more sensitive, so you may not be able to use the same potency of product, or you might not be able to use it as frequently, but always bring your neck into your skincare routine. And while I'm speaking of neck, bring your chest into your skincare routine, bring your hands into your skincare routine. These are all areas that show a lot of sun damage as we get older and tend to age us, so don't just focus on your face. Now, some habits that you can incorporate to help how your neck ages is thinking about your posture and some of your habits in which you are looking down, whether you're looking at your phone or you tuck your chin when you sleep. Those are all things that are going to contribute to horizontal neck creases. Now, cosmetically, there are things we can do to correct that to some degree, but prevention is the name of the game. I'm not a big hacks person, but one of my favorite life hacks is to take silicone scar tape, so the thing we have patients use after surgery to improve the appearance of their scars, and you can actually apply it to horizontal neck bands, especially when you're sleeping or hanging out at home, because that will prevent your skin from creasing. So for example, I have a lot of patients who sleep on their side and they wish they could sleep on their back because they know it's better for how their skin and neck is going to age, but ultimately getting good sleep is better than teaching yourself to sleep on your back if that's not a comfortable position for you. But if they apply those silicone sheets to their neck when they're sleeping, then at least when they're on their side and their chin is tucked, they're not worsening those creases. And that's meaningful because you're sleeping for 6, 7, 8, 9 hours a night. So if you can do 9 hours of neck prevention every single day, you're gonna be in good shape. Tip number 8, get your acne in check. I treat a lot of adult female acne, and basically every patient who comes in is like, listen, Dr. Ellis, I am too old to be breaking out. And I agree, there is something you can do for that. Even if you never had acne when you were a teenager or in your 20s, it may not be that your hormones have significantly changed in your 30s, but your skin is responding to your normal hormone levels in a different way. These hormonal pimples tend to look a little bit different than the traditional acne that someone may have had in their teenage years. They tend to be these deeper, cystic, more tender bumps on the chin and on the jawline. And there are definitely treatments that we can do to make them a lot better. The other thing is I find that people kind of are delayed in coming in. They might have been dealing with acne for 2 or 3 or 4 years and they're like, oh, I thought I was just gonna grow out of this. And the thing about adult acne is that you don't tend to grow out of it as readily. So if it's something that bothers you, get in with a dermatologist and start making some interventions. Tip number 9 for skincare in your 30s is consider a cosmetic consult. I feel like a lot of people in their 30s are starting to think about things like Botox or lasers, or they're starting to see their peers get these procedures and they have a lot of anxiety because they're sitting at home going, do I need this? Should I be talking about this? Am I old enough? Am I too young for this? And really the best step is to get a cosmetic consultation. What I talk about with my patients is the fact that you should never feel pressure to do anything, but the more you're informed and the more education you have, at least allows you to kind of get your mind around what's possible for you and maybe have a timeline moving forward. It can be hard to know who to see for a cosmetic consultation, but I typically recommend starting with a board-certified dermatologist or plastic surgeon, someone who does cosmetic procedures all the time. Don't get me wrong, there are amazing physician assistants and nurse practitioners out there who inject and do lasers, but training can really vary and it's not necessarily standardized, so it's harder to guarantee what kind of experience you may have. I'd say some of the most common procedures that I do on patients in their 30s are things like Botox, some light resurfacing, whether that's in the form of lasers like Fraxel and Clear and Brilliant, or IPL, also known as photofacial. Also things like chemical peels and microneedling can be helpful to resurface the skin and help stimulate collagen. The other thing we'll often do for patients in their 30s are beautification procedures. So we're not necessarily trying to anti-age them because many people aren't showing signs of aging in their 30s, but they feel like there are things they could do to make them feel a little bit more attractive, whether that's adding a little bit of volume to someone's lips or using a little bit of Botox in the masseter area to slim the jaw. No matter what, if you're getting cosmetic procedures in your 30s or just getting educated about them, you don't want to leave the office looking like a totally different person. The goal really here is to prevent and to make you look like a better version of yourself or just a little bit refreshed. When I think about my friends or the patients that come into my office who are in their 30s, they're always a bit hesitant to do cosmetic procedures. And honestly, I think that's a good place to start. I'd rather someone be nervous about cosmetic procedures than just go in and want to do everything. But they're also concerned that they're going to look fake or overdone or get botched. And the reality is, if you're seeing an experienced injector, someone who's experienced with laser, and you're in your 30s, they're really going to guide you to look like the best version of yourself, to look more refreshed, and everything should be subtle and natural. I also want to mention that everyone is on their own cosmetic journey, everyone ages differently, everyone has their own cosmetic goals. And so just because all your friends are getting Botox, you might not be ready for Botox, or just because your friends are getting lip filler, that might not suit you. So it's really important to find a cosmetic provider that is going to tailor your treatments and your recommendations to your goals and the skin that you're currently in. I also think about the fact that you want to form a long-term relationship with your dermatologist or whoever your cosmetic provider is, because aging doesn't happen just once and then you never see your injector again. I love to see my patients at least a couple times a year, and it doesn't mean we're doing procedures every time they come in, but we're just touching base, figuring out what their goals are, having a plan for next steps so that they continue to age in a way that is graceful and they know what's coming next. And my final skincare tip for people in their 30s is to prioritize your overall health. It's really hard to feel confident in your appearance if the rest of your health has taken a hit. And this can happen in our 30s. Our lives get busier. We might be committing to our sleep less. We might not have an exercise routine anymore. We might not be eating the best, but all of those things make a huge difference in the health of your skin and the way your skin ages over time. So things like sleep, exercise, nutrition, therapy to help with stress management, actually going to the doctor. Preventative medicine is a thing, and seeing people before you're feeling ill or before you're having certain complaints is also a really big part of maintaining and managing your overall health. One of the reasons I wanted to become a dermatologist in the first place is because so much of what happens internally is manifested externally on the skin. And oftentimes you can look at someone and tell that they're not healthy just by looking at their skin. And so many times I have patients who come into my office who are dealing with a breakout or hair loss, and it's not due to anything that's specifically happening with their skin. It's due to a life stressor or another event or a separate illness that's affecting how their skin or hair looks. And sometimes someone may be struggling with a health condition that hasn't even been diagnosed yet. For example, someone who has hypothyroidism or low thyroid function, they may have signs of it on their skin, like dry skin, brittle nails, hair that's falling out or shedding really easily, and a dermatologist can actually make that diagnosis. Not to mention, when you're not feeling good, it's very hard to prioritize taking care of your skin or your hair, so it can become this vicious cycle. So there you have it, 10 skincare tips for your 30s. Now, you don't have to go out and incorporate all of these all at once. Baby steps, you're in your 30s for 10 years, so you have a little bit of time. But as you work to make these changes, I think you're going to be a lot happier with your skin. Do you have any 30s skincare tips that you want to add? Put them in the comments. As always, thank you so much for watching. Don't forget to subscribe to the channel and like this video, and I'll see you next time.